Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, Anita Finley.
Normally, we would be hearing Dr. Federico Martinez, who is the medical director, physician, Healthpark Medical Center. He did a show last week, and we were going to hear him, but because there's a little bit of an emergency, we are going to talk to Jeff Hines, who's his patient care coordinator, and is so enthusiastic about Dr. Martinez and everything that he's doing that I think this will be an excellent interview. Thanks for being here with us, Jeff.
Well, thank you so much, Anita. I really am quite pleased to be here with you because we really want to share some really important information about new trends, new ideas in medicine that really will have an impact in helping many, many of your listeners.
I love that. And your enthusiasm is just coming over the airwaves so well. Okay. Well, first of all, Dr. Federico Martinez is an extraordinary physician. He has I would call it new ideas. They're not new ideas. It's just that he's one of the few physicians that are putting out all these ideas, right?
Well, that's exactly correct, Anita. If you think about it, if you're, one of the things that I used to do is go to doctors' offices and really visit exactly how they're running the medical business. And, I put myself in the shoes of the typical patient. You have an appointment for 1 o'clock and you get there and you sit in the waiting room and it's a big megillah. It's a big headache. And, the doctor can only give you 10 minutes if you're lucky. So from the doctor's standpoint, he's more or less forced into that regimen. That's the way the government and the insurance companies have kind of evolved the practice of medicine. Let's do it quick. Let's do it fast. Here's the symptom. Let's provide a solution. What is the solution? There's a pill. Now, the problem with that medical model is we're not finding the cause of the problem. We're not eliminating the problem. It's palliative care. It's simply glossing over whatever the issues are using some sort of chemical scenario that, of course, if you ever think about the side effects, on the one hand, it's going to help you with your symptoms over here, but on the other side of the coin, it creates more problems in other of your bodily systems. So Dr. Martinez has really gone after finding the cause of the problem.
But that takes time, and that's what you were saying, that because most doctors don't have the time, they miss then what's going on. And that's why Dr. Martinez is changing the whole idea of medicine, isn't he?
Well, he is. And, you used the word earlier, functional medicine. And I think that's what is really, really important today, especially to, the people that you help are people born between 1947 and 1964. And, unfortunately, as we get older, and unfortunately I'm in that population, what happens? Your body starts to tell you there's a problem. And what can you do? And so when you go to your regular doctor, you have 10 minutes and, maybe this will work and maybe it doesn't work. So really, Dr. Martinez, and just to back up a second for you, what got him involved in this? Really, this is what, he was 25 years a pediatrician. And he was doing the normal medical model. One child every 10 minutes, boom, 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 let's figure out antibiotics and this and that. And, when I was also a big brother, and I saw my little brother, he went from a normal size to this gigantic size in like a year. I said, what is going on here? And I kind of put these ideas together in my head. Why is so much of America having such a problem with their weight, their body, and all this? And when I met Dr. Martinez, he was talking about something called leaky gut. Leaky gut? What the heck is that? Never heard of this word. Anita, have you heard of this?
Yes, I have heard about leaky gut.
Tell me about leaky gut.
No, but it's a very strange thing that there are things happening in your stomach that shouldn't be happening, and because you're putting all sorts of, it's like inflammation. And inflammation, and he talked about that in his last show, inflammation causes a lot of problems. And so he even got me starting probiotics. When I was listening to him, I went right out and bought probiotics because I don't want to have a leaky gut.
Well, what he said was this weekend or last weekend, he spent the whole day, all day Saturday from 8:30 to 5:30 in a room full of doctors, and they were talking about gluten. And I said, gluten? What the hell's gluten? This is something new to me, too, because, of course, I love pizza and I love spaghetti and I love all these carbohydrate things. And so what he talks about with the leaky gut is if you just imagine Now, we're on the radio, so I can't show you, but just imagine you kind of lace your fingers together, and that's the barrier between your stomach and your circulatory system. You don't want the waste from your stomach to go into your circulation. Why? Because then it's carried by the circulation system as part of the blood, and it gets into all the other systems of your body. And that's what starts the disease process. That's what starts the disease process. That's what's so important about what he talks about.
And so are there tests that, I know that he's very good at looking at people and figuring out things, but there must be tests that he has to do to be able to make it a concrete diagnosis.
Well, that's a great time. I'm a patient care coordinator. Anita, we were joking. I'm wearing my pink scrubs and my tennis shoes today because it's my job to help the patients, but I am not the doctor. I'm just, I talk to the patients and try to help them, get coordinated with their care and so forth. But this is really a question for the doctor. But what I can tell you that in a simplistic way, what I see is that the doctor is very sophisticated in his testing. Today we met with a testing company and we went through the differences between, one of the issues is cholesterol and statin. And I think he might have mentioned this to you, Anita, at one point where he was talking about, the measurements of cholesterol are not really indicative of exactly what's going on with your heart and your coronary system. And on the one hand, if you start taking a statin, well, that does reduce the cholesterol, but is reduced cholesterol really the answer? And then does statin really prevent heart attacks? And those are issues that he can talk much better about. But I can tell you that from what I've heard, I would have a lot of doubts about staying on a statin.
And that's really what he was sharing when he was on our other show. And I know he'll be back on our next one. But he did say that not all cholesterol is bad. And it's kind of like with eggs. I love eggs, but I was told I can't have eggs. And now all of a sudden eggs are good.
Right.
So, but he needs to see the whole person. That's the functional medicine part, isn't it?
Right. Well, he was talking about his mother this morning. His mother is 96 years old and has a cholesterol level of 400. And she's had that her whole life. And she's never taken a single statin or a single heart medication. And she's 96. Can you believe this? So anyway, one of the things I wanted to talk about, I wanted to kind of shift backwards and talk about how the doctor got into this. And this is a really incredible story. I started to tell you the 25 years as a pediatrician. And the one thing that we all know in our lives, once you've gone through 25 years with a particular business, it comes time to reevaluate. Well, what happened for him, his wife got very sick. Very sick. And he saw the whole medical process for treating cancer. And he saw that there are big, big issues with how do we treat cancer? And how do we keep the patient alive instead of just extending their life for a certain period of time and then boom, they're dead. So he went through this transformational energy. So he transformed his thinking completely from normal everyday medicine, 10 minutes for the patient, let's give a pill, to now thinking about the causes. So one of the things is that is kind of the confluence of this is, of course, the insurance companies aren't prepared for this kind of an idea. This is not what they want to, it's 10 minutes. We'll pay the doctor. Maybe, unfortunately, the patient, they have to pay maybe $100 or $75. The doctor only gets $30. He doesn't get any. It's not a big amount of money the doctors make on these office visits. But the point is that's their model and that's what they're used to, so that's what they do. But my point is with Dr. Martinez, he says, no, we can't do that. We can't exist on 10 minutes, a pill. That's not going to solve the problem. So he is essentially a concierge doctor. In other words, he does not take insurance. So this is for people who are interested in finding the cause of their chronic disease. Chronic disease is something, fibromyalgia. I used to go to doctors' offices, and I can tell you, many, many doctors were dealing with fibromyalgia. How are they dealing with it? It's completely unknown. The doctor will say he doesn't even think fibromyalgia is really a disease. It's a condition caused by the leaky gut, caused by all that bacteria going through your circulatory system. That's why you have pain everywhere. That's what he thinks. That's his hypothesis. So for people who are suffering this kind of a thing, he will go through not only figuring out the cause, but once he figures out the cause, then he'll give a program to really rebalance your body. One of the things that you and I know, Anita, having lived as long as, unfortunately, we're here, the body wants to heal itself. Am I right?
Definitely. We always knew that. People interfere with it all the time.
Right. The body wants to heal itself. So if we get out of the way of the body healing itself, voila.
Right. I wanted to go back to something that he had said about this. He gave us some examples of some people who came in and they were suffering very badly. And so I think he said, and he looked at them and did a diagnosis, and he said in a couple of days, they came back to him and said they felt so much better. It was simple. It was only a few things that happened. I was very impressed with that. So when you talk about doctors not taking the time, it takes time to find those things out.
Well, one of the things I really want to stress to our listeners, Anita, this is not something about money. This is about commitment. This is about helping the patient. This is what doctors become doctors for. But of course, in the course of supporting your kids and your wife and your family and your multiple things that you got to support, it perhaps tends to lose its focus. But Dr. Martinez is committed. When he went through that process with his wife, and it took, it was a 7 or 8 year process. So this dramatically changed his thinking. And so it's about the patient, and it's about helping the patient. So, of course, we offer a free consultation. So the point is that you can come in and talk to the doctor directly and tell him all your issues and tell him all your history and go through line by line, and there's no obligation whatsoever. So I want people to feel free to call us.
I'm going to give you the number, everyone. The number is 954-573-5464. And I'll repeat that. Remember, this is Pencil Talk Radio. Get your pencils in your hand and your notebook. 954-573-5464. And you can also go to their website, which is healthparkmedical.com. Healthparkmedical.com. And Dr. Federico Martinez is the physician. And we're now talking with Jeff Hines, who is the patient care coordinator. And Jeff is so enthusiastic. I love having him share all his knowledge, because I think you admire Dr. Martinez so much and you watch him and what he's doing to help people.
Well, I do. And I tell you that this is not just from me, without any kind of experience. I mean, I've watched many, many doctors in the course of my career, and I can see the difference. I don't mean to say anything negative. Believe me, the doctors work so hard, but they are more or less strangled by the issues that they face, which is money is always an issue. The staffing is always an issue. You have to have people to run the office, but then that gets into all the drama and all the issues that the staffing has. Then the doctor has to organize as a businessman, how much am I spending on staff? I mean, there's a lot of issues for them. So they get caught up in the business side of medicine. And of course, then the scientific part, that question may be put to the weekend, and then the weekend you're busy, and then so it kind of gets pushed and pushed. So what I wanted to share with you is Dr. Martinez has spent the last 3 years studying this issue. And he's taken all the courses, he's gone to all the seminars, he's studied with the most prestigious universities and most prestigious medical researchers to figure out what we're talking about in terms of functional medicine.
Yes, and that's, I said functional medicine to someone else the other day, and they said, what is that?
Right.
So how would you describe functional medicine?
Well, Anita, going back to our thought process about how is, if you think about the history of medicine, and you think back about the days when the doctors used leeches, and, we used to bloodlet the patient. I mean, the history of medicine tells us that medicine changes. And yet there are forces within the medical community that resist change. Of course, they have financial interests and their education and all that. So, but every 10 years, a new idea comes about, and it's going to grow and grow and grow and revolutionize. I predict this is going to revolutionize medicine. This is going to say to the doctor, no longer can you spend 10 minutes with a patient. You really have to find the cause. And now we have the tools, because you mentioned earlier about the lab tests. So the lab tests today are so much more sophisticated. They are going to allow the doctor to analyze the different segments of the body. But then the issue is putting it all together. If you think about a puzzle, a giant, what's the word I'm looking, it's a giant puzzle that you put all the pieces together. I forget what it's called.
A mind mapping, but that's not really it.
No.
Well, I understand.
So we're a puzzle where you put the pieces together.
Right.
It's a kid's game.
Yeah.
But that's what the doctor does. You put all the pieces together. Once you have the lab test, the history, you've spent 2-3 hours with a patient. You've analyzed every aspect of their medication going back to when they were little kids. One of the things the doctor talks about is antibiotics and how antibiotics can destroy the bacteria in your stomach. And you could have a problem because, the antibiotics change the balance of the bacteria within your stomach. And so
that's when he said to take probiotics was very important if you are taking an antibiotic.
Right. He said probiotics will remember what I said, the interlacing of the wall between your stomach and your blood system.
Yes.
So the probiotics will help re-energize, relace that barrier so that it'll keep the bacteria out of your circulation system.
Yes, I listened very carefully, and I told you I was on an antibiotic for a short time, and I ran and got the probiotics, and so I have listened to him. He has had some very good advice, even though we only did this on the air for half an hour. I had heard him before talking,
right,
and he is quite brilliant, and it's very exciting to be working with someone like that. I'm sure that you feel that way. That's why you're so committed to this. But one thing that I know he will talk about when he comes on next time is hormone imbalances, because he feels that's really causes a lot of problems.
Well, if you're in an airplane and the airplane you hit some turbulence and you're at 35,000 feet and the airplane starts to dive, okay, what are we going to do? That's kind of what he uses that analogy in terms of our bodies, because when we hit a certain age, it dives. Our bodies dive. We lose the hormones that we had when we were 35, and those hormones are no longer there. So now when you wake up and you can't get out of bed, or it hurts to get out of bed, or walking down the stairs gives you pain, or you don't have the energy that you used to have. You want to go home at 4 o'clock instead of out and partying till 3 in the morning like we used to. So that's all about hormonal imbalance. And that's one of the things that he's very, very interested in is, for men, it's testosterone. For women, it's estrogen. And then it's also about the balancing. So I know that with testosterone, there are many companies out there that advertise about testosterone, but it's something that is not, it really is not a commodity. Testosterone is not something, you just go and, get on testosterone. It really is a question of balancing the hormones, because too much testosterone can harm you. It's a very delicate balancing act.
Well, let me add something to that. I remember having a staff member who was dating a gentleman, and of course they were sleeping together, and she had no problems normally with her heart, and all of a sudden she's starting to have heart palpitations, right, when she's at the office, and it was getting worse, and we had to call 911, and it turns out that she was sleeping next to him and he was taking testosterone, putting it on his chest. Mm-hmm. And that's what it caused in her. So it can be a very dangerous thing if it isn't watched, is what you were saying, Jeff.
That is true. So one of the things that I also wanted to talk about just briefly was, if I can switch gears. Regenerative medicine. So This is something that, of course, fascinates me. Of course, who doesn't want to have their face remade? Please, give me a new one. You know what I mean?
Your face is very nice, but go ahead. You want a new face, that's up to you. But I don't think you need one.
Well, thank you so much.
Okay, so regenerative medicine.
Regenerative medicine. So this is another new branch of medicine where we can help people who they would otherwise be thinking about plastic surgery. They would think, I need my face lifted, or I need these wrinkles removed, or whatever it is cosmetically. And so the idea is regenerative medicine. It kind of combines cosmetic ideas with medicine and saying the body, again, going back to that idea, the body will heal itself. So now you say to yourself, well, wait a minute. How will the body heal itself when I want to do a facelift? Facelift, they raise the face. They raise it underneath surgery. This is something new, relatively new. So the whole idea is if we inject cells that are your own cells, what's it going to do? It's rejuvenate, re-energize, redo. So the whole idea here is, and of course I'm speaking strictly as a layman, But the results that I've seen have been fantastic. And I know there was some talk about Kim Kardashian was one of the ones who popularized the very first version of this some years ago. It became very popular on the social media, talking about a vampire facelift. Well, what do they mean, vampire facelift? What's all that about? But that was like the first generation. Now we're into so much higher technology. It's no longer a vampire facelift, but the idea is there, using the patient's own bodily cells, their own blood, to create a new face.
So as cells, cells are deleted or they are disappearing, and they're the old cells, we want new cells, and you're saying that...
Well, Anita, if I can interrupt you.
Yeah, please.
Yeah, it's, what's underneath the skin?
Cells.
Well, collagen.
Oh, collagen, yes, of course.
And then also, the knees. I mean, for me, I played basketball, I skied, and all that wear and tear on your knees, and what happens... I'd always hear people talking about bone on bone. I'm going to go get a knee operation. What are you going to do in the knee? Well, they're going to replace my knees. And what are they going to replace it with? Oh, they're going to give me a new knee. I said, whoa, is that complicated? And then I had a friend, and I was at his house, and he was lying in the living room in a cot, and he was in so much pain. I couldn't believe it. This is what they do to replace. Oh, my God. So the whole idea with the knee is, you've got cartilage in there. And what is cartilage made of? It's made of hyaluronic acid and lots of other things. And so if you can figure out a way to get hyaluronic acid and all those other things back in there, the cartilage will regrow, and now you're no longer bone on bone. Again, that's my simplistic analysis. I'm not the doctor, but I see tremendous results for people who have bad knees, bad backs, shoulder, elbow, wrist. What are we doing? We're letting the body heal itself by maximizing the youth of the youthful cells within the body.
Yeah, that's now it's coming to the forefront about injecting your own blood back into your body, and I know that's something Dr. Martinez is very high on.
Well, that's
he believes
called
in this.
PRP, plasma enriched protein, PRP,
and that's true, and that's something that now is. Years ago it was kind of frowned upon because people didn't understand that.
Right.
But Dr. Martinez, the thing about Dr. Martinez that impressed me is he does a lot of research in all this. And he certainly wants to make sure that what he's going to tell his patients and do with them is really right. Don't you
Yes.
agree? I mean, he's...
Well, the commitment that he makes and the office makes, this is a group effort of all of us in the office. This is part of our commitment to the patients and to our listeners. We want you to know you can come into our office, talk to us about these issues, and we will help you for free. We're going to give you a consultation, and you're going to walk out of our office knowing a lot more about what's going on inside your body than you did before.
Okay, I'm going to give you that number again. It's 954-573-5464, 954-573-5464, or you can go to the website, which is healthparkmedical.com, healthparkmedical.com. It's kind of like you're talking about functional medicine, just like now we have all this technology that you can go to a website, that you can do things we never had that before. And so that's what's happened, I think, with the whole technology of medicine. He's on the cutting edge of many, many things. And I'm really so pleased to have him share all this with our listeners. And so my guest also, I wanted to say again, is Jeff Hines. When you go to see Dr. Martinez, I have to assume you're going to kind of be hanging around there.
Well, you know what? Let me give our listeners my cell phone. If they have trouble getting through, if there's an issue, they don't want to wait for an answering device or whatever, you can call me directly. I try to answer my phone every time it rings. My cell phone is 954-245-2002. Let me repeat, 954-245-2002. Anyone who wants to get through to the doctor, and if there's an issue or whatever, it's 24/7. Call me, and we'll get an appointment for you to see the doctor right away.
I don't see so many people as energized and dedicated as you. You must really be a big believer, and you said you've been involved with medicine for a long time, and then when you find someone that you just feel you want to help so that you can get that person to the public, that's what I'm looking at, I believe.
I think, Anita, the whole point for me, we only have a short window here. unfortunately, our lease is up, and we don't know when that lease is up. So really it's about how can I give during the short period that I have. Don't you think?
No, that's true. Now, some of the people that Dr. Martinez has already seen, they're pretty happy.
They are. It's been a terrific ride, and of course, when you come into our office, we'll be glad to share all that with you.
And your office is actually in Weston.
We're actually in Weston. Now, don't let that address worry you or bother you. It's something where you're going to get a full consultation. I know it's a hike for some people in Boca or wherever you live, but on the other hand, we're going to spend the time with you, and it's going to be well worth your time. And then, of course, the doctor, once you become a patient, the doctor can make arrangements to
see you maybe more convenient,
locations.
Right? But let me just say that I go out to Weston a lot, and nowadays with the highway system, it is not that far. So, and when you think about it, there are people that fly up to Cleveland Clinic, or they go to Sloan Kettering. If something's important, that's not a very far distance to go.
Right. Well, this can dramatically affect your life, Anita. That's what really gets me excited about how we see a dramatic, I'm not talking little changes, I'm talking about dramatic changes that we can do with people's lives.
Do you know, though, Jeff, something that I think is very important? It's not only that Dr. Martinez will be able to figure out, because he has a lot more time, it's the idea that someone cares, that he's sitting with patients. That in itself can help cure people. You know that.
Absolutely. Absolutely. The psychology and the psychodrama of medicine is so important, and how we feel about ourselves. So the doctor understands the psychology of medicine very, very well.
And you're going to be there to hold their hand.
Whatever.
And your enthusiasm, and you are so cute.
We're going to make everyone, at least we're going to make them feel better.